I've loved plastic surgery ever since I can remember. I first met some of the most notable fathers of plastic surgery back in my medical school days when I was 25, and have been in love with plastic surgery ever since. Without a doubt, I'm totally in love with facelift surgery. Facelift is one of the most impactful surgeries I think that I've ever encountered. So many individuals are a good candidate. I think that we commonly will have a good deal of individuals who are women in their 50s, 60s, and 70s. Now, 20% of our patients are men, but women are predominant. After having a really tailored facelift performed, you're going to have really great results that you can see the next day. But we work through it in terms of the healing phase. The healing phase, takes days for us to get to a point where we're, reasonably, the swelling has come down and we reasonably look ourselves and see that real great rejuvenation. During the consultation, we really would like to talk about the specific individual needs of the patient. And so often we have women who have just the concerns of the jowls and the neck and the changes there, the aging that we see there. And so we really go over that with them and talk about what to expect with the procedure, go over before and afters of other patients, talk about the procedure itself, about the postoperative recovery and what to expect and what reasonable expectations are. So a number of things go into the consultation, and really sit down and talk with the individual about what the upsides, downsides, and expectations are, which is really helpful for the full process. Walk you through things, make it really comfortable. It doesn't take very long from the time that you show up, and we go ahead and go forward with the procedure. And the procedure is comfortable, and there's no pain, and you're very relaxed and/or asleep. After the procedure, we go through the instructions and make sure that everything's taken care of. Yeah, for facelift surgery, we really go over the postoperative discussion and care. It's really within probably 7 days that we have to sort of take it easy and not do not a lot of exertional activity, go through a whole protocol of bandage use, of ice, and so forth. But the real question that most of our patients will ask is, when can I get back to social activity, be able to go to the grocery store, to Starbucks, and that sort of thing. And I usually give the time period of 10 days. And by 10 days, we should be reasonably capable of getting out socially. So after the procedure, we have a full discussion, a full protocol, and it's all written out. It's very simple, very easy. Pretty much taking it easy is the mainstay of what we want to do. We have a wrap that we utilize and pretty much wear that for the first week. I think that a week's period of time of doing a lot of nothing is very, very helpful. We have written instructions to go over, and we see each individual the day after the procedure, somewhere in the range of 6 days to 7 days after the procedure, and we're always available by phone, and just basically walk the individual through the postoperative care. Yeah, everybody has swelling and bruising after the procedure, but I think that one of the key elements to this is, after doing thousands of these procedures, after doing thousands of facelifts, there's really specific techniques that can be utilized to try to really improve the recovery period, to heal better, quicker, faster. It includes things like applying the wrap appropriately, seeing individuals appropriately after the procedure, using ice, using various techniques to make sure that things heal appropriately. So there are rare occasions where bruising is moderate, but generally speaking, we are able to keep the bruising to a minimum, and again, by 10 days, should be able to get out, maybe with a little bit of makeup, get out socially and participate in life activities without any concerns socially. Doing facial plastic surgery, I can't think of anything that's more fulfilling, because what you see is individuals who have real changes and in their appearance and the way they feel about themselves, and we always try to couple that with going forward and trying to change other parts of their life in terms of, you know, eating right and exercise and so forth. But there's nothing quite like facial plastic surgery, because this, you can't really cover this up. You can cover this up, but you can't cover this up. And so really rejuvenating the face, particularly for us folks that get over 50, 60, 70, this really can impact individuals. And so it really is fulfilling from my perspective.